Good morning, SAJE community, and thank you for joining us today. This morning, we are pleased to have Wilma Schmitz from the Claim Office to discuss the 2021 Medicare updates and changes with you. Please feel free to call me or email me or Wilma with any questions that you have as you're reviewing this. And if you'd like the printout of the slides, please feel free to let me know that as well. Welcome, Wilma. Thank you very much for your time. We appreciate it. And I know I always look forward to these presentations because I always learn something interesting that is happening in Medicare.
Oh, well, thank you and hello to everyone. And Medicare is ever changing. And I'm a social gerontologist by education. So I have a master's in gerontology, and I'm also a teacher of gerontology. So you'll have to forgive me if I do a slight sidetrack when I talk about aging and Medicare. But I'd like people to think about this. Every day, 10,000 people turn 65 in this country. And that means that they become eligible for Medicare. If you've seen commercials and there are sports figures touting Medicare, it's because they know, the companies know that Medicare is a very big business. And what we do at Claim is to tell people about their options. And so today, that's what we're going to talk about. So let's get going. I'm happy to be with you today. So we're going to talk about Medicare Part D and Medicare Advantage plans for 2021. And here's the agenda. We're going to talk about Claim because if you're like a lot of people, you're going, what's Claim? And we're going to talk about the Medicare supplemental plans because I'll explain that a little bit later. Medicare Advantage plans, which are Medicare Part C, and everybody's going, didn't know that there was a such thing. Yes. And Part D, of course, is drugs. And the last topic will be how to stretch your healthcare dollars. For people with limited income, there are programs available to help you save on your healthcare costs. So with that, let's get going. So who is Claim? Claim is the Missouri State Health Insurance Assistance Program. We are part of a network. Every state in the union and territory have a state health insurance assistance program. So if you were in Ohio, their program is actually called OSHIP. We go by Claim. We were started years ago, and actually we were created in 1990 because Congress felt and saw that people were having a lot of questions about what Medicare covers and the costs were going up. And so it was created back in 1990. Here in Missouri, we work with and receive a grant from the feds, give grants to states, and our state chose to have a not-for-profit run their SHIP program. So the Department of Commerce and Insurance received the first grant in 93. And excuse me, I do have dogs. And that means that I just had a delivery. So back in 93, the Missouri Department of Commerce and Insurance awarded a grant to the Missouri Connections for Health. And that's who we who Claim is a part of. Want to let everybody know upfront, claim counselors, and I am a claim counselor as well, we do not sell or promote any insurance company or any products. So the reason that we exist is to be an unbiased group to talk to and educate people about their options when it comes to Medicare. So if you have a question ever, and we're asked all the time, well, what would you recommend if you were talking to your mother or your father? My answer and all the counselors is that it's so individualized, and we do not promote or recommend any company. We want the person to make that choice that's going to be best for them.
Wilma?
So counselors train, we work with the from Medicare and Medicaid services, better known as CMS, and we work with the state departments as well. So CLAIM is a statewide program, and there are over 300 volunteers and 180 community partners. And we're always looking for volunteers, and we're always looking for community partners. So we would love to have people that are interested become part of what we do. So how can a claim counselor help? Well, surely it's the first thing we do is we help people understand what Medicare is, how to enroll, if a person has a question about billing, Medicare supplemental plans, such as Medigap is another word for that, another title, Medicare Advantage plans, drug plans, public benefits. So there are benefits that I'll be talking about a little bit later that really will help pay for your deductible, and also Medicare Part B deductible, and also some of the co-pays if your income is low or limited. We also help people start the appeal process. Let's say that a bill came in and it just wasn't like the bill showed up. We will help the person figure out the approach to go and to appeal their billing. We also help in when someone says, wait a minute, I received a bill and an explanation of benefits, and that's not me. Then we work with organizations to file reports because there is fraud and abuse out there. So let's look at, for those that are new to Medicare and for those that have been in Medicare for a while, let's do a recap of what Medicare covers. It's a health insurance program that most people, if you've worked 10 years and paid into Social Security, you get Medicare Part A automatically with no premium. It is also administered through the Centers for Medicare and Medicaid Services. For those that have worked for the railroads, they actually have their own Medicare card, and we work with people, especially in the St. Louis area, that have retired from the railroad. So that's what your Medicare card looks like now. If you have a Medicare card still that has a Social Security number on it, please destroy that. It is no good. Providers, doctors' offices, hospitals Cannot use that. So we want to protect everybody. That's why Medicare changed the numbers, because so many people were being um, fraud was being happened because the people's social security numbers were tied to their Medicare number. So please destroy those. 4 parts of Medicare. Part A is hospitalization. Hospitalization, that means anytime you go into a hospital, it's inpatient care. And I'll use my mom as an example. 2 years ago now, I found her on her floor in her home. She lives independently, and rushed her to the hospital. She was admitted, and for 4 days, she was in the hospital, needed to be rehydrated because she had a urinary tract infection. She was so weak from that. After she left the hospital, she needed to go to rehab for skilled nursing. That was covered, both of those were covered by Part A. When she was released from skilled nursing from rehab, she went home, but she still needed to have a little more supervision of her health care. So she had home health. Now, there are a lot of people that once they are diagnosed with a life-ending illness and they choose not to continue treatment, they enter into hospice. Medicare covers some of that cost as well. So if a person needs blood, Medicare helps pay for that as well after the first 3 units. And then there's a cost associated with that. Part B. First thing you do when you go into a doctor's office, they're asking you to sign your name, and then they're asking you for your insurance cards. That's Medicare Part B. So it covers hospital, the doctor's office, outpatient services, some home health, it depends on the situation, ambulance transportation as well, therapies. So when my mom went home, she had a physical therapist come in, and just to make sure she was getting stronger and doing her exercises. She had an occupational therapist because she has a vision problem, and she needed to get used to that again. Some people need to have speech therapy. Let's say they've had a stroke. Thank goodness my mother didn't have a stroke, and she didn't have to have speech therapy, but speech therapists are covered under Part B. Clinical services, so drawing blood during urinalysis, all those things, that's under B. Durable medical equipment. Now I'm going to step aside, and the gerontologist is going to come out and say, please, if you need to have any type of device, such as a wheelchair, walker, things that are going to help you around the house, please check with your provider, your medical provider, because if you just went into a store and purchased an item, that would not necessarily be covered under Medicare. And so people will go out and buy things because it's convenient, it's there. Family members said, well, mom needs a walker, so I picked up a walker. May not be covered by Medicare. So please, please remember that. The other thing that Part B covers, and this will happen a lot starting in January again, when you go to your provider for the first time, they're going to ask to update all of your records. Then they're going to say, well, let's go talk about some of the things that we want to make sure you have your immunizations. So, of course, they're going to ask if you have flu shot, pneumonia shot, if you've had a tetanus shot. So, if you work outside or around the house, even, you don't want to cut yourself and have some problems set up. So, there are a list of different preventative services that are available to you that are covered by Medicare. So I'm going to make sure that the ministry has books that they will hand out to the group so that you will know about your preventive services, and that's covered by Medicare. So that's a good thing to have. Let's talk about the different insurance supplemental plans that help pay for Medicare costs. When Medicare was enacted, and here's a trivia note for everybody, the first two people to receive their Medicare cards were Harry and Bess Truman. When Harry left the White House, one, he was financially broke, and they actually drove from DC back to Independence alone, no Secret Service, no entourage. It was just he and Bess driving back to Independence. And he didn't have health insurance. Presidents back then weren't given health insurance. So Harry had worked to try to get health insurance for older adults for many years. And actually, back to Teddy Roosevelt, he tried. FDR tried, Harry tried, and finally in 65, Lyndon Johnson signed the Medicare bill. So in celebration and in recognition for all the work that Harry had done, President Johnson went to Independence to sign the bill and to give Harry and Bess the first Medicare cards. So when you play trivia, remember that Harry and Bess, number one, number two in Medicare. So one of the things about Medicare, it was never, ever supposed to cover the entire cost. It was always 80% of the entire bill was supposed to be paid by Medicare. The person was responsible for 20%. So Congress came up with a plan. Let's have a supplemental insurance or a gap insurance to help pay for those costs. And that's where we get the Medigap or supplemental insurances. What it does, it covers costs that weren't covered by Medicare. It also was enacted because medical, if you think about back in 65 versus now, the technology and therapies have just skyrocketed, not only with availability, but also with costs, because we have to pay for research and things of that nature. So that's why the supplementals were started. For the individual, a percentage of their income was going, a higher percentage was going into covering the gap. So that's why Congress started through Centers for Medicare and Medicaid, started the supplemental plans. So they're sold, the Medigap plans are sold by private insurance companies for individuals. So there are brokers out there that sell Medigap plans, and they are governed by both the federal government and, in Missouri, the state of Missouri. So there is an open enrollment when it comes to signing up for Medigap plan. And if you have any questions, if you're about to turn 65 or you have a family member that's going to be listening to this, our friend, you want to check with us so we can tell you what your options are, and we will be able to help you up to the point that you have made a decision. And then from there, you would contact the company. And most companies have you contact a broker in your area. So the costs vary by plan. And when it comes to Medigap plans, policies, they have their own letter system, and they go from A to N. And so each one has coverage in different ways. So if you want more information, we'll be happy to give that to you. One thing that's so very important is to understand that the insurance companies, if they sell a plan, and there are maybe 30 plus different companies that sell a plan, the plan letter, let's say F, all those companies have to do the same coverage. So letter F, you get certain coverage, and but the price are different according to the company. So you want to talk to someone independently like us so that you can know what your options are. We can do a phone consultation and work with you so you are better equipped to know your budget and also what coverage you want. So that's what's important to know about Medigap. And also that the Medicare Advantage plans do not work with a Medigap plan. So you want to choose one or the other. You cannot have both. They're monthly premiums. And this last little bullet, plans C and F are no longer available for people that are just coming on to Medicare. If you have a C plan or F plan already, don't worry about it. You can keep your plan. It's just the new folks that are coming on that aren't allowed to enroll into those two plans. This is the Missouri Medigap shopping guide. We will send that to you free of cost. And in that guide, it describes each letter plan. It also describes the coverage and a worksheet that you can go through so you can decide on your budget and how much is important to you if you're interested in going into a Medigap plan. For those of you that are newly retired, congratulations. And also, if you have employer insurance and you're still working, there's a special things that you need to be aware of when you turn 65. That's definitely a time to call us. We'll be happy to tell you the ins and outs and make sure that you get the coverage you need. And especially if you belong to a union, you want to be very careful, because if you go with something outside of what your union or your employer retirement insurance coverage has, you can lose benefits for life. And we don't want that to happen. So before you make that choice, talk to someone with us, and so we will help you with that. Okay. So again, with unions, make sure that you talk to someone in the union or talk to us, and we will be happy to help you with that. Medicare Part C. And someone saying, I've never seen that on my Medicare card. You never will. Medicare Part C is to help with paying that 20%, because not everybody has the financial wherewithal to want to have a Medigap plan in some cases. And there are other options that are available through Medicare Advantage plans. So, you're seeing those commercials now. That's what this is all about. It's still administered by private insurance companies, and it's a different way of receiving that Medicare coverage. Every plan that is a Medicare Advantage plan must cover all the original Medicare coverage, must carry that. But what they do, and when I do presentations in person, before this year, this very interesting year, one of the things I always say, if you can imagine a big cauldron, a pot, and you put part A in, and you put part B in, and you mix it together, and part C. Plus, part C has some Medicare Advantage plans also can offer additional benefits, such as drug coverage, hearing, vision, dental, and transportation in some cases. And in some parts of the country, they're actually authorized to include other things such as pest control. The East Coast was really inundated with bed bugs. And so Medicare will now cover in some parts of the country exterminators to get rid of bed bugs because that is a health problem. So we will see how this plays out with COVID. And there's coverage now for telemedicine that wasn't there a year ago, 2 years ago. Now it's covered because of COVID. How does the Medicare plans work? Well, you're still enrolled in Medicare with all those rights and the protections, but the benefits, the coverage is what is that 20%, as I said, that's what's going on, and that's what's the Vantage plans help with. Some plans require prior authorization to services. So we'll talk about that a little bit as well. Some of the eligibility. You must live in the service area. So you cannot live, let's say you go to Arizona or Florida for the winter. A Medicare Advantage plan would not work for you. You have to live in that plan service area. And the service area for this St. Louis metropolitan area is St. Louis metropolitan area. Columbia is not covered under the plans here in St. Louis area. Hannibal is not covered. So if you have a cabin or you go and live certain months of the year in a different part of Missouri, you want to check with us because there's a good chance that you have to weigh what's more important to you. Okay? So one of the great things that's going to happen in a few months is that people with end-stage renal disease, kidney disease, they can now have a Medicare Advantage plan. They have that option. In the past, if someone had kidney disease, they weren't allowed to be in a Medicare Advantage plan. So one of the other things you have to do is you have to fill out an application. But that's that's one of the requirements. And you can only belong to one plan at a time. So those snowbirders, if they live in Arizona for 3 months and they say, well, I'll just get a plan there, it won't work because it's all tied to your Medicare number, okay? So now you're going to say, wait a minute, you're looking at the slide and you're saying Medicare Advantage open enrollment period, and then you see January through March, and you're going, well, wait a minute, they're talking about open enrollment now. That's a different open enrollment. So hang with me and we'll explain all this. So if you are in a Medicare Advantage plan and you're new to Medicare, you can actually enroll different times. But let's say you're in a plan and you enroll into a plan and you find out January 1st or the first week in January, you call your doctor's office, they say, oh, no, we no longer accept that Medicare Advantage plan. You have a choice. Either stay with your current provider, your doctor, because, trying to find a new doctor that you like is really, really hard. So you can actually change plans. And that's where we come in and we can help you with that too. But you can only change once. So what you choose in January through March, you have to stay with that plan unless there's certain circumstances until next October. So what you choose is very crucial. Okay. All righty. So you can switch plans. You can leave Medicare Advantage and go back to original Medicare. And there's some special enrollments. So sorry about the acronym. The special enrollment period are SEP. And we can talk to you about those. So there's some special circumstances. And Part Ds are not guaranteed coverage until starting January 1. So we'll go through that a little bit more. Because most Medicare Advantage plans have the drug plan included. So we're going to talk about very briefly the various types of Medicare Advantage. You've got the HMO, Medicare Advantage, Medicare Maintenance Organizations, where you have to work within a network. If you decide to go outside of your network of providers, your doctors and therapists and that, then you're responsible for a larger portion of the charges. And most HMOs require prior authorization. So if you have an HMO, they will say your primary doctor or provider will say, well, Mrs. Jones I'm writing a prescription for 4 visits to a physical therapist. So each time the physical therapist, it's approved by the HMO, and if the physical therapist says, well, we need more time, then that whole process has to start over again. So that's a HMO. A PPO, different. You don't have to, in many cases, get a referral, and you can go as often as the doctor who's in network will write the prescription for. So it gets kind of complicated. PPOs have a smaller amount of providers, usually. So you want to check. And if nothing else from this presentation, I'd like you to take away one thing, is that what works for you with Medicare may not work with a friend or family member. So it's not one size fits all. If you've seen one person that's on Medicare, it's not going to be replicated easily for another person. The third type of Medicare Advantage plans that are available are private fee-for-services. And that you don't have to have a primary provider. And they have different stipulations of how you work in and out of network. So again, you want to check with us. Medicare Advantage plans, you still have to pay that that premium for Part B, because that's what goes to pay your plan. So you want to go and sign up for that. You're going to have Part B. You sign up for that, the deductibles and the costs, and they're out-of-pocket maximums. So you want to check with the counselor to make sure that you understand what is in your plan if you choose a Medicare Advantage plan, and you want to compare every year because every year things change. So you want to have a checkup with a claim counselor so that you know that you're going to get the best coverage possible. A little bit earlier, I talked about people that have Medicare Advantage plans and that they have end-stage renal disease. Well, there is a program here in Missouri that is very helpful. They have claim counselors at the Missouri Kidney Program, and you really want to call them if you're diagnosed or you are just learning that you have end-stage renal. You want to call them right away to make sure that they have that you have the best coverage possible. If you have questions about the drugs that you need to take, you want to get in touch with Missouri Kidney Program, and they are a proud partner with Claim. So we're really happy that we have that resource for you and for all of us that live in Missouri. So please call them if you have any questions, if you are dealing with any type of kidney issue. Part D. Before Medicare Part D, everybody had to pay for their prescriptions out of pocket, 100%. Oh my goodness. You think about the next time you go to the pharmacy and your slip, your receipt, your information will say how much you saved by having Part D. And that is substantial in many, many cases. So Part D, again, is administered through independent private insurance companies, and they work with Medicare. So Part A and or Part B. So you can have Part A, which is no cost to you premium-wise, and say you're covered by a spouse's insurance or your retirement insurance, so you don't have to have Part B, you can still get Part D. So there are two sources of coverage. You can have a standalone prescription drug plan, or you can have one that is tied to a Medicare Advantage plan. Okay. Part D helps pay for those outpatient prescription medications. So now we have an option that 10 years ago was not even thought of. You can go to a store, a drugstore, a pharmacy, or you can have mail order. And mail order, you get 3 months supply usually. So those are for medications that aren't going to change. If you have high blood pressure, your medicines are not going to change possibly. You can go and pay less money through mail order, and you leave a, you go to your pharmacy, your local pharmacy, for things like antibiotics when you have some type of illness. So it's short term for a lot of people. They use the pharmacy, local pharmacy. For long term, they use the mail order is an option. So that's one of those great things that's happened, and it's a money saving venture for consumers. So enrollment is not automatic for Part D. And please, please, please understand, if you don't, say you're healthy, you don't take any medication, you just became 65, there are plans that have no to little out-of-pocket premium. But think about, here's the gerontologist coming out again. Most of us can live 10 to 15 years longer than our parents. My mother just turned 90. And that, going with that, I could live to be 100. Ugh, the thought. But it's a possibility because medicine, technology, food, all those things help make us live longer and hopefully healthier longer. So back to YD, why I brought that up, is that if you're healthy and you don't take any medications and you'll say, I'm not going to enroll, there is a penalty if you don't sign up for D when you're first eligible. So you want to make sure you get that coverage and that it fits your budget. So each plan has a formulary, which means a list of medications that are covered by that plan. And then some plans have preferred pharmacies that will give you even lower costs. So you really want to look at that, talk to one of our counselors. We can talk to you over the phone with no problem about that. What's happening in 2021? Well, the premium for Medicare Part B is going up. We know that. And we also know that the average cost for a Part D plan is also going to be $33.06 a month. And there's that penalty thing right there. If you don't enroll, there's a penalty. The deductibles. The maximum deductible is $435 a year. So what that means is actually if you pick a plan that has a deductible, you will have to meet that deductible before the plan kicks in. And that can get kind of complicated. So you want to talk to a counselor about that to make sure. And the cost sharing and the formularies will tell you if it's a tier 1, that's usually free or very low cost, to all the way up to tier 5 or 6. And that means that the medication is not covered by the plan. So it could be like all those commercials we see about all types of medications that are new and they have a brand name. Well, those are usually higher in the formulary if they're covered at all. So you want to check and make sure when a doctor actually writes a prescription that there are other alternatives. Usually there are. So you want to make sure you talk to your physician when that happens. Well, someone's saying right now, but Wilma, what about the donut hole? It's a horrible name for something that's so good, a donut hole. But that meant a gap in services. So if a person pays, the plan will pay 75% of the cost, and the beneficiary will pay 25%. And that's when you've met your deductible and you've maxed out and there's a gap in coverage. So you want to make sure that you, if you can, talk and plan so you know budget-wise what you're going to have to pay for a medication. So you want to talk to a counselor about that. So when are you eligible for Medicare Part D? The first 7 months of when you're eligible for Medicare, you can sign up for Medicare Part D. Open enrollment is happening right now. So everybody is getting inundated with mail. I had a friend call me this morning and she said, I'm getting so much mail from every insurance company. And that's right, because they've done their research. They know everything about who is going to become eligible. And they're trying to woo you to join their plans. So every plan is going to send you mail. So you want to make sure that you enroll in during a good time. So there are some special enrollments. If you retire and you're going to lose your employer coverage, one of the things I tell people right away is get a letter that says you have credible coverage. That letter comes from your HR department or your benefits manager. And that says that your plan, your coverage for medication was as good, if not better than Medicare. So it's just a lateral, not that you're moving up or you're going down, you want a lateral. So you want to talk to us about that. If a person is moving in or out of a nursing home, that's a special enrollment because nursing homes, long-term care facilities have special agreements. And if someone is approved or loses extra help. So there's all kinds of things that are happening when it comes to special enrollment. One of the ones that's happening is folks that have lived abroad. I have a girlfriend from college that's been living in Costa Rica for 10 years, and she's actually coming back to the States. So she's going to have to do all kinds of things to decide where she's going to, what type of coverage she's going to get. But she has a special enrollment. So again, we're in the middle of open enrollment, and look at this. People are saving money by signing up for Medicare Part D, going and looking at their plan for next year because the plans are changing. And we want to save money. That's the number one thing. We want our beneficiaries, our clients to save money. And we do everything we can to make sure we look through all the literature to make sure that they get the best deal. Okay? So the cost again is the average cost is around $41 for a Part D premium, but there are some plans that are zero premium and there are deductibles. And we talked about late enrollment and the formularies. What's covered, what's not. If a doctor has to have prior authorization, step therapy means that the drug companies are saying, or the plans are saying, that we want you to start with the oldest, tried and true medication. If for some reason it doesn't work, then you step up. Then you step up. It happens a lot with high blood pressure because some medications will have side effects that are not good. And so they may switch. So that's what step therapy is about. And quantity limits means that for pain medication, and this is really something that's hitting home now again about opioids, you can have just 30 days amount for some medications. And you have to, the doctor has to write a prescription that every month for different pain medications. And that's to try to stop the abuse of opioids. Let's talk, last but not least, how are you going to save money? Say you have very limited income. There are plans that will have zero premiums for Medicare Part D, reduced copays and insurance, and people that qualify for this subsidy can switch plans. So it depends on that person's income and resources. So the Medicare savings programs, there are federal programs with state programs. They're income-based, so that Q and B, we're big on acronyms in Medicare, of course. The qualified Medicare beneficiary. There's income and assets, or resources rather, determines what type of assistance you can get. And we actually have the applications, and we can help you apply for these services. Missouri Health Net is one of those services, better known as Medicaid. So a person that is on Medicaid and Medicare, they can get low-income subsidy to help pay for their Medicare, their medications. They can have help paying for their Medicare deductibles, their premiums, and their co-insurance. So you want to check. And all of our counselors are certified confidentially. We don't share information. And after each counseling session, counselors are required to destroy any paperwork. So I can't remember my own passwords. I'm not going to remember anybody else's. So all of our counselors are like that as well. Here's a quick chart of income and resource guidelines. So if a person, single person, has income of $1,600 roughly a month, they can get low income subsidy. If their income is as low as $905 a month and resources under $4,000, they can have even more coverage. So I will make sure that there are brochures that the ministry will have. So if you have any questions, you can look at this, talk to your family about it, so we can make sure that if you qualify, we want you to apply and get that coverage, because it's important for you to stay as independent as possible and also have the best coverage possible. Let's talk about fraud right now. A couple of years ago, there was a group that was out with tables, lab coats, stethoscopes, and they were standing outside of supermarkets saying to people, you let me swab your mouth, you give me your insurance cards, we can tell you if you'll ever have cancer. I couldn't stop it. You know, I couldn't say to those people, you're lying. But I had to work through the system. And the first thing I did is called the Senior Medicare Patrol. And I gave them the information. I even had photos of what the booth looked like. And this was 3 or 4 years ago. Got a phone call just last year from a special agent with the FBI, because they were working to try to recapture money to stop fraud and abuse. So I encourage you, we can't tell you if it's fraud. That's a legal terminology. But we can work with you so that you can file a complaint, because that's costing all of us. So we want people to understand that you can help detect and their errors. I received I'm not on Medicare, but I received a bill from a health insurance company that neither my husband nor I have. How they got my husband's information, I don't know. I've worked with companies or organizations to figure that out. So you want to make sure that you look at those bills and also the explanation of benefits that come in, because people are human. A 6 can become something else. 2s and 7s, all kinds of things can happen. So you want to make sure that you get the coverage you need and that you're charged properly. Well, one way to check those explanation of benefits is to have a My Medicare account. So mymedicare.gov. Once you set up that account, you'll be able to look at all of your Medicare information, all the explanation of benefits. You can order a replacement Medicare card. You can view all types of services. You can look at the drug plans and look at those things. So it is administered by the Centers of Medicare and Medicaid Services. So we can even help you set up an account. So our volunteers are trained to do that. And I would say they probably do at least 30 or more during a month's time, especially now. So we want you to have that. The government says they want you to have it, and you can find out more information about you than you thought you knew. So that's a good thing to know where your Medicare dollars are going. Last but not least, if this presentation interests you and you say, oh, wow, that sounds really cool. The counselors are doing things and they're helping other people in the community. We want you to think about it, becoming a counselor. All the training is done online. I'm one of the trainers, and it's not easy. You get to learn all types of information, and when you sign up to be a counselor, you make a commitment to help others, and that's what we're looking for. So initial training starts February 2021, and we have it's roughly a month and a half, not every day. There's videos, there's quizzes, there's all types of things that will help you become a counselor. After the final quiz, you will become a certified claim counselor, and you will be assigned to work out of a partner site. And we're hoping really, really soon that we'll be able to make an announcement about a new partner in your area. So we're looking for people that are interested in helping others. And we're also looking for people that can help us administratively as well. So if you're interested, let us know, let the ministry know, and we'll make sure that you get all the information you need for that. I see that my internet was a little unstable there for a minute. So again, if you have any questions, answers, we can get those. And these are the contact numbers. So you call our 1-800 number. They will route you to a counselor in our area. And if you look at the map, we're in Region 2. You can go to our website, MissouriClaim.org, and see all the services that we offer and how we can help you. If you're on Facebook, friend us, Missouri Claim. There you will see different announcements, community education. We post something every day. And last but not least, if you have a question, you can email us. Please don't include any personal identifying information like Medicare number, just your name, phone number, and generally what you have a question about. And our call center will route that to a counselor in your area in Region 2. So with that, that's the end of my presentation. Jessica, back to you.
In the studio. Thank you again, Wilma, for your time and energy and the wonderful information and expertise that you shared with us. I know that we'll probably get some questions. So please, again, feel free to call claim 1-800-390-3330. The claim information is on the SAJE website as well. So if you have any questions, you can always go there. A couple quick things I want to remind people of. We are signing up for leaf raking. So we don't have any dates as of yet. But we are getting the list together. So give me a jingle, 664-9700 if you want to be on the leaf raking list. And I do want to remind everyone that Advent is still hosting our Thanksgiving dinner. This year is our 16th dinner. And as most of you know, Phyllis Powers did pass away last week, who was the second person of the team that started the Advent Thanksgiving 16 years ago. But we are still going forward with Thanksgiving. We will be having a drive-by or delivery. You do have to RSVP by Friday, November 20th, please. And the menu is turkey, mashed potatoes, gravy, green bean casserole, cranberry salad, stuffing, heart attack corn. If you've ever gone to a lunch and learn, you know what that is. And a homemade dinner roll made by Deb. So please feel free to either give me a call or call the church office or Facebook message or send an email. We are asking for your 3 thankfuls when you RSVP. So keep that in mind. And again, you can either pick up. We have more than enough drivers that are happy to deliver lunch. We will be delivering and picking up on Thanksgiving Day between noon and 2 p.m. So if you have any questions, please feel free to reach out and give me a call. Also, please feel free to reach out and give Kathy Sherwood a call if you have any faith community nurse questions, medication questions, interactions, nutrition, anything like that. Feel free to call Kathy. You can reach her at 314-208-8884. Again, her information is on the website. Thank you, Wilma.
Thank you.
Have a wonderful rest of your day.
Okay, thank you much. All right, bye-bye.